up when he comes in, and he only does lift it up halfway, and like that. And he's struggling to do that, right? Right? That's my active range of motion. See what he can do for us. What is my next option for him? I would do what?
Eliminate gravity.
Gravity eliminated position. So for his left shoulder, okay, what position would I be in?
Right side.
Right sideline, okay? Shoes off? Shoes off, by the way, for everything. Because if you think I hop on it, wait till you get to thorax. Right? You want to help?
Sure.
Okay. Alrighty. Are you comfortable? Okay. Alrighty, good. Alrighty, so. Alrighty. You want another pill?
No,
You want this?
I didn't know what that was for.
Okay, no. You can have it. You want it in between your legs?
That's alright.
Okay. Alrighty. So, what's the key in gravity eliminated position? Right? Does his vertebral column or his trunk need to be in a good alignment? Is that, because if he's crunched over like this, is that going to affect the amount of motion he has? Yeah. So basically, I want to make sure his spine is in a proper alignment. Okay? So, Kevin, can you just sort of bring your right shoulder back a little bit for me? Okay? Alright, good. Now, looking at this, alrighty, what should I be more in front of him or more behind him? In front.
In front.
In front would be better. I could see what's going on. Alright, because which direction am I going in for shoulder flexion? Anterior. I'm going to be over here somewhere. So I would need to be in front of him. So I would be this way. Right? Okay. Now, if I'm testing him, I would be more in front of him. If he is in a gravity eliminated position, right? Because he was only able to do something like this. Is there more likelihood of substitution now or compensation?
No.
Yes or no? Is it more likelihood? Will he try to, possibly do more type of substitutions or anything like that?
No, right?
No, probably not. But can he engage all the other muscles that can do it? If I'm looking one specifically. Say, for example, I really want to know how strong his anterior deltoid as compared to his long head of the biceps. Right? Can the biceps, if it's a little bit stronger, can this sort of take over the motion more?
Yeah.
Yeah, absolutely. So at this point, you definitely want to do, in a gravity eliminated position, you want to make sure you palpate all the muscles that's involved. Alrighty? Again, it's not like palpation for, looking for like tenderness or anything. You want to see when they're doing the motion in a gravity eliminated or even against gravity position, what muscles are actually taking over or what muscles are doing the activity. Alright? Because again, it's not up there. You have anterior deltoid, coracobrachialis, and biceps, long head of the biceps. That's possibly going to be doing the activity. So I want to make sure I'm palpating. Okay? And to me, he looks like he needs another pillow. Alright? To help with the alignment, because can him going into neck flexion throw it off a little, lateral neck flexion.
Yeah.
Alrighty? So you want them as best as possible. The lower arm, you just need to put it somewhere where it doesn't look like he's laying on it for too long. Okay? Somewhere. Wherever he's comfortable. Are you comfortable like this, Kevin?
Yeah.
Alright? Now, since he's all the way on that side, does it look like it may be difficult for me? Like leaning into him too much? Yeah. Can you come a little bit closer? Alrighty? Alright? Okay? Try not to bend your neck like that. Try to keep it straight as much as possible. Alrighty? And you, as a clinician, you gotta look for this stuff. Okay? You want everything in a line. Okay? So, what I'm gonna be doing, I am gonna be supporting him this way. You guys see everything? No. Alright, well, okay? I'm supporting him like this now. Alright? I'm not helping, I am gonna do my best not to help him do this. Right?
Yeah.
Right? Because I shouldn't be helping him. I'm just gonna support him. And what I'm gonna do, I'm gonna have one hand cradle, alright, drop it in my hand. And how do I know?
It's heavy.
It's heavy. And it did get heavy. It got a little bit heavier, okay? I just want you to see how you bring your arm up. What do I need to do at this point? As he's bringing his arm up.
Move with him?
Huh?
Move with.
I gotta move, alright? So you're gonna be at a position of readiness, okay? That's usually either standing astride the direction that he's going to, or just standing astride, alright? Try not to do the baby step, this thing, kind of thing. Don't do that. That's just gonna end up hurting you, alright? So you always only wanna shift your weight, not step out of his way, alrighty? So on the count of 3, drop it in my hand again, okay? Drop it, alright? I want you to just bring your hand up over your head for me, please, okay? 1, 2, 3. All right, go, 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 go. And I'm gonna let him go, alrighty? And if I need to, I'm gonna switch my hand. I don't need to for him. Sometimes, depending on the person, I may need to switch. Drop it in my hand, because he's holding it up for me. All right, is this as far as you can go? Good. Alrighty, now bring it back. That's the first time I'm doing it now. I wanna sort of see which muscles are being activated right now. Alright, so I'm gonna sort of place my hand right here, alright, and feel for the muscles, okay? So on the count of 3, can you bring it up for me one more time? 1, 2, 3. Go, 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 go. Alrighty, as far as you can. And bring it back. Okay? Yes or no?
Yeah.
Alrighty? Now, primarily I did just only feel his anterior deltoid. Okay? If I wanted to feel the coracobrachialis and see if that's coming into play, alright, we'll try it one more time. 1, 2, 3. Not really. He's just using primarily his anterior deltoid. So you want to see which muscles are really doing it. Alright? Again, he's good. Alright? He's normal. He has normal strength, so he's not going to substitute or not. If he started substituting, if he's that weak and he started substituting, what may he try to do? You think? What may he try to do?
Shrug.
Yeah, might try to shrug. Alrighty? Alrighty? He may try to lean back or fall forward. Alright? So you're there to stop him from doing it. Yes or no? Okay. Are you okay? Alright. So, questions about gravity eliminated.
So while you were doing it, you supporting his hand?
I was just trying the best I can not to guide him. You don't want to guide him in it.
But you want to support it?
You want to support him. You really, truly want to just follow his lead, okay? And it can be difficult sometimes, because what do clinicians like to do? Help. We like to help. When you're doing manual muscle testing, and you want to see how strong they actually are, right? Particularly for anything that's gravity eliminated, you're supporting them. So that support always, is indicating them, oh, help me a little bit while you're there, kind of thing. So you want to make sure you're not doing that. You want to let the patient take the lead, okay? All right, so if we are talking, okay, we still have time. Shoulder abduction. What's a gravity-dependent position or against gravity position? Sitting. What else? What else can possibly be? Supine? Oh, I skipped hyperextension. Okay, well, we have time. We have time. Alrighty? Supine?
Sideline.
Sideline.
Like this.
Sideline like this. Is this a great position to do resistive though?
No.
No. Alright, it's not gonna be for me, because he's honestly gonna, before he even reach 90 degrees, right, it's gonna be awkward for me to put that resistance. So what's the best position for him?
Sitting.
Sitting. Okay, can you sit up? It's whichever arm you want.
We'll switch. We'll use this one.
Okay. Alright. So again, same thing as reflection. You want to start it at the beginning of the range. If you have a petite person, alright, you might be able to get away with it in the middle of the table, looking at the arm, alright, especially if it's a kid, alright? But if you happen to have, a tall person, alright, you may need, again, move them over to the table or put them in a chair, alright, that no wheels, okay, alright, to do this. Yes or no? That makes sense, right? Okay, so what am I gonna ask him to do first? What am I gonna say? We did the intro stuff already. We did all that stuff already, alright?
You extend your arm out to the side.
Yeah, can you extend your arm out to the side? Alrighty, good. Is that high as you can go? Pretty much, okay. Yeah, I know, remember from last time, you were limited. Alrighty? Alright, now, thinking of that, if you go by definition here, alrighty, fair grade, okay? means full range of motion, or 3 out of 5, or fair grade means full range of motion, right, in against gravity position, right? Do it again. Right? And you honestly can't go any further, right?
Yeah, no.
No. Even try externally rotating a little bit. A little bit further. Is that full range?
No.
No, it's probably like 150-ish. Alrighty? If I go by definition alone, should I be adding resistance at this point? If I go by definition alone? No, okay? Again, you're sort of taking liberty at that, okay? Because a person who has a lot of soft tissue, whether muscular or fatty tissue or anything like that, and it's blocking them from going into full range, alrighty? Is it appropriate for me to put them in a gravity eliminated position to test for strength? Do you think?
No.
If it's just soft tissue, you know it's soft tissue and that's in the way. Should we?
No.
No. Alrighty? So again, you're sort of looking by definition. I probably shouldn't be, but I also look with the observational skills and looking at him. I know he can lift that arm up against gravity, and it's a controlled motion. But if you're looking at definition-wise, I probably shouldn't be, right? Because he did not have full range. Alrighty? So again, there are times therapists take liberty with that definition. Right? Your CI asks you something like that, you need to explain it to them. Right? This is sort of getting that critical thinking coming into play here. Yes or no? Okay, I know I diverged. Thank you. Alright, thank you. Alright, so, well, I'm safely assuming he has full range, okay? I'm safely assuming, and he does. Alrighty, so I'm gonna add resistance, okay? What muscle again? We just talked about them? Middle delt and supraspinatus, okay? So what I'm gonna ask him to do, hands at your side, okay? Alrighty, alright, can you just lift it up for me? Good, alrighty. Can you put it back down? I wanna make sure I feel all the muscles coming into play here. I'm just gonna palpate a little bit, bring it up. Yeah, and I feel that middle deltoid coming into play. Alright, and bring it back down. Can't really feel the supraspinatus because of his muscle mass right now. Now that I wanna add resistance, okay? Typically I will stay more in front of him, but I'm gonna stay a little posterior lateral of him so you guys can see where my hand position is. Alright. If he was gonna do something, what might he do to substitute or compensate? Lateral flexion, shrug the shoulder, anything like that. So I'm again gonna be at a position of readiness, right? Right? So I'm gonna be up here. My resistance should be where? Should it be on the muscle itself that's doing the activity or below it? Just distal, just, proximal to the elbow joint, distal to the deltoid tuberosity, somewhere there, alrighty? This is also gonna give me a good position, so keep at his face, make sure he's not holding his breath, and I'm gonna tell him, try not to hold your breath when you do this. Good place for me to sort of stabilize and feel for the muscle contraction, alrighty? So on the count of 3, I want you to bring your arm up, and I'm gonna just resist you a little bit, alrighty? Alright, and just, whatever I give you, you give back to me, okay? So on the count of 3, bring it up, 1, 2, 3, go, 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 and he's really strong, alright? And back down, alright? Good? Alright? And so what I felt not really his deltoids, but I did feel some tension up here being produced, okay? Alright, so I'm here, one more time, okay? On the count of 3, 1, 2, 3, go, 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 and I'm keeping an eye on him, and relax, okay? Questions? Okay? What position would he be in for gravity eliminated? Supine. Can you go supine? Whichever one. Your right arm okay?
Yeah.
Okay. Supine.
Always supine.
Alrighty. Alrighty. So, remember what I said about pillows? If they want a pillow, you always give your patient a pillow, right? No matter what. Alrighty? But what you also want to do, be aware of, is not making sure those pillows aren't flexing them that much. okay? And you also wanna make sure these pillows are not gonna be in the way. So can you lift up one more time? Go there. Is that good? Are you okay?
Yeah.
And if they really want the pillow there, like right in the middle, yeah, you give them the pillow. All right, you just give it to them. So where would I be supporting him? Posterior.
Above the lacuna.
Yeah, probably right up here. And again, arms do get heavy, all right? So I'm gonna be cradling it, standing astride. This isn't, I could tell already, this is not gonna be comfortable for me. I'm gonna go this way, all right? And so I'm gonna be cradling it, right? And at this point, again, gravity eliminated, you wanna make sure the muscle's working. You're gonna wanna do the palpation and the actual motion separately, right? Now, this table does not go up, okay? For me, I'm gonna have to what?
Lower your.
I'm gonna have to squat down a little bit, okay? I'm gonna have to squat down a little bit. And for me already, I'm gonna need 2 hands because I'm gonna need to change my positions readily, alrighty? So I'm gonna be here this way, and I'm gonna ask you, can you bring your arm up over your head now? Okay, on the count of 3. 1, 2, 3. No.
Oh.
Up over your head, like you're going
Oh,
out to the
yeah.
side and up over your head, okay? Drop it as best as you can. Alrighty? Okay, and start at the beginning, okay? So on the count of 3, bring it up, bring it out and up over your head, okay? 1, 2, 3. Alright, and I'm gonna switch my hand position a little bit. Try to drop it as much as you can. And he doesn't really have good range. Alright, so this is, I know, for him. Alright, and I'm gonna bring it back. What am I doing, gravity eliminated right now? Going back down. This one was what?
Abduction and adduction.
Yep, abduction and adduction. I just showed you adduction. Okay? Alrighty. So if I'll do it again, and I'm gonna palpate for the muscles now. What muscles would I be palpating for?
Middle belt.
Middle deltoid. So I'm gonna have my hand here. Alright, so on the count of 3, bring it out to the side and up over your head on 3. 1, 2, 3. Alright? And I'm gonna try it as best as I can, and I feel his muscles contracting. Alright? And then bring it down. Okay? Alright? So again, we're gonna be looking at you while you're doing it, Mr. Mitchell and I. Looking at your body mechanics doing it. No one see this. Alright? Bend your knees. Because again, you guys are gonna be doing it for quite a while, right? Alright? So that's gravity eliminated, shoulder abduction against gravity, and gravity eliminated. Yes or no?
Yeah.
Okay? So getting for shoulder hyperextension, what's the best position to make sure it's against gravity?
Prone.
Prone. Okay? So, can you go prone for me? You getting tired?
No.
Okay. Hey, oops, sorry. Hey, do you want a pillow for your stomach?
Yeah.
Alright? It just makes them comfort. Just ask. They want a pillow, they want a pillow. Yeah, just, come this way, Kevin. Alright, so they can see, so everybody can see. Alright, so I want you, actually, go back over a little bit. Right here. Put your arm right here now, okay?
Oh.
Okay, put your arm. Are you comfortable?
Decent.
That's all. No,
Oh no, I thought that's what I was looking for.
no.
Then
Tell
yeah.
me. No, but
Then yeah.
is it, are you uncomfortable?
No.
Are you sure?
Yeah.
Okay. Alright. Like, so, what I want you to do now, okay? Usually I like to have the head as, turned to one side or the other. Okay, so, because what does this do when they're doing cervical hyperextension? You really don't want that. Okay, so can you turn your head? Yeah. Okay? Are you comfortable like that? Okay. Alright, so, can you, okay, do you feel like your arm's falling off or no?
No.
Okay. Alrighty. Can you bring your whole arm up to the air for me? Thank you. And bring it back down. Good. Alrighty. You want to scooch over that way so it doesn't fall? Is that better? Okay. Alrighty. So you want to be prepared. Look at how they're laying down. Okay? Do they look like they may be endangering themselves? Possibly? If they are, fix it. Fix it. Because, you know, yeah, your classmate's not going to fall off the table. Alright? They're not. A patient will. Okay? Alright? So you want to be careful. Alright? So, can you... you like your hand up there?
Yeah.
Yeah. Can you try to keep your back straight as much as possible? Because you're sort of leaning a little bit. Okay. Alright? Okay. Okay, can you keep your other arm down here also, or no?
Yeah.
Is it uncomfortable?
No.
Okay, alright, because he was just, the way he had his arm up here, he was just really, sort of like tightening up here and sort of laterally bending already in his upper trunk. Alright, so I wanna make sure he as straight as possible, because again, you wanna look at the whole alignment. Okay, so, this time around, okay, can you lift your arm up again? Good, and back down. What muscles do this? Posterior delt, what else? Lats, okay? So, yeah, what you want to do when you're looking at these muscles, you want to make sure you palpate the big guys involved, okay? Your posterior delt and your lats, okay? So can you do it one more time for me? Good. And I feel his lats primarily, not so much his posterior delt, right? And bring it down, okay? He's using his lats to do it. So I'm going to need to add resistance now, all right? Because he had good range. Alright, so I'm gonna need to situate myself inappropriately in a manner where I can apply resistance and stabilize as necessary. So where do you think I would be? If he was gonna cheat, what would he do? In other words, he would shrug. So I probably would want to be more up here. Alrighty, so I'm gonna put my hands over here more, because if he, and especially what else is over here? What's this thing? His head, his face. All right, I need to keep an eye on what he's looking like, okay? Because you always want to keep an eye. Over there, I'm probably not going to be able to see his face as readily if I need to, right? And he did me a favor. He turned his head towards me. All right, so I'm going to stabilize here, all right, if he was going to do anything. Because remember, stabilization, you're not quite sure 100% of the time where you need to stabilize. More for the fact you don't know how they're going to substitute. You have a general idea what they're going to do, so that's why your hand is always at a position of readiness, okay? So I'm going to just put my hand here. My resistance should be where again for hyperextension? Above the olecranon again, okay? Yeah, right here, okay? So I'm going to ask you to do the same thing, okay? All right, you're going to lift your arm up, and I'm just going to give you a little resistance. Alrighty, so on the count of 3, 1, 2, 3, go, 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 and relax. Alrighty, you okay? Alrighty, so first what I did was just to see how well he did and see if there's any substitutions or anything like that. Okay, the second one, alright, I added a little resistance. Alright, and oh, sorry, the second one was I did the palpation, right? The third one is when I added a little resistance. And again, if I needed to do it again, would I do it? If I had to? Yeah, if I had to, I would do it. Can that skew your results a little bit? Yeah, because what am I doing when I'm manual muscle testing? You're making him tired. I'm making him tired. So you sort of do need to be careful when you're doing this. Because more for the fact you are making him tired. All right, so that's gonna mess up your results a little bit. All right, so if that's for hyperextension, alrighty, in against gravity position, what position would he be in for gravity eliminated?
Sideline.
Sideline. For the right arm, it would. Sorry, for the left arm, it would be.
Right side.
Right side. Can you go right side, and then we're done. Alrighty, so once pillows, he can have his pillow. Alrighty, can you go left sideline for me? Now looking, oh, which one are we doing? Oh, no, right sideline, sorry, right sideline. Okay, if we're doing this hyperextension, what position, where would I stand in relation to him?
In the back.
In the back. I would probably be more back now. Alrighty, so I'm gonna need to make sure that he's okay, because I can't really see his face, because when he goes into hyperextension, I'm going away from him, right? Alright, so I'm gonna need to just sort of make sure, you okay when I'm doing this?
Yeah.
Alright, and check on him, okay? Can you bring your head back a little bit? He likes to do this a lot, okay? Alrighty, keeping him like this, okay? I'm gonna lift him up, okay? Drop it down, okay? By the way, am I abducting slightly? Yeah, not much we can do about that, okay? Alrighty, if he was gonna compensate somehow, what may he do? Lean back, okay? So to prevent him from doing that, come back a little bit more towards me, okay? All right, so I'm here to help him, okay? Right? I'm gonna palpate for the muscles. Right? Primarily which ones again? Posterior deltoid and lat. So I'm gonna be like this. Alright? And again, I'm also gonna getting ready to get out of his way when he goes into hyperextension. Right? So on the count of 3, can you bring your arm back towards me for a little bit, okay? 1, 2, 3. And I'm gonna watch. Does he tend to hyperextend? And he actually is a little bit already. Alright, bring it back. Alright, try not to lean back so much. Okay? If you need, okay, good. He did it already. He put his elbow to sort of stabilize him a little bit, so he could, make sure he's not gonna fall back too much. Alrighty? So to help him along, I'm here. I'm gonna spread out my hand and my forearm a little bit. Alrighty? So my hand, where's my forearm? His lower back. I'm just gonna spread out so I could feel for the muscle contractions, right, and stabilize him as much as you can, okay? Kevin, I want you to go as far back as you can now with your arm, but don't lean back, okay? Try to remember this position your trunk is in right now, okay? So don't lean back into it, okay? So on the count of 3, you're gonna do the same thing. 1, 2, 3, and back, all right? Bring it, and again, I'm trying very hard right now not to guide him or pull him into the motion, all right? We'll do it one more time. 1, 2, 3, bring it back towards me, all right? Yes or no?
Yes, ma'am.
Okay. Now, what's another important reason for sort of palpating the muscles? You want to see what's contracting, right? Okay. But very importantly, right, when you're thinking about he's in a gravity, if you're actually testing a gravity eliminated person, alrighty, can all the muscle fibers always be contracting in gravity eliminated?
No.
No. What if it's like, looking at a grade that's like 2 minus or trace? Alrighty? So that's why you do want to always make sure you palpate for the muscles that are contracting. You're looking at which ones are contracting, okay, what muscle is primarily doing it, and how much of those muscle fibers are actually doing it. If you barely feel, only a few fibers doing it, then you're thinking more on the trace to pore minus side than say the pore itself side. Yes or no? Right? Questions? Okay. Hey, before you guys go, remember that first sheet I showed you in the manual?